Right, back with you tonight here on In Focus. We'll continue our conversation on the reaction to Limpopo Health MEC's comments. Joining us now is the Limpopo member of the Provincial Legislature on Health, Lilian Managa, and the Chairperson of the Nursing Union, Denosa in Limpopo, Lesiba Monyaki. Lilian, good evening, and Lesiba, good evening. Good to have you with us. Lilian, let me begin with you. There's been a call for the MEC to be sacked coming from the economic freedom fighters. Why do you believe she needs to be sacked when she strongly believes she's raising issues of concern of the abuse of the system that they have instituted there of conducting surgeries throughout rural parts of Limpopo?
Thank you so much, Thabo, Julie, and the listeners, and good evening to everyone. We don't call it abuse of the services as the economic freedom fighters, because everyone has the right to life and everyone has to get quality health. So as the economic freedom fighters in Limpopo, we are condemning strongly the conduct of the Limpopo Health MEC, Dr. Phophi Ramathuba, at Villa Hospital with the contempt it deserves, Mr. Mjoli.
Yeah.
Her entire ill-informed and inhuman performances in addressing sick patients who are waiting the surgery, like our own sister who is coming from Zimbabwe, is inconsistent with all human standards of patients' confidentiality and dignity. And no one deserves to be treated like that. Whether you come from Zimbabwe or wherever, no one deserves to get such a treatment.
What do you make of the issues that she's raising around the burden of elective surgeries that are meant for South African citizens being overtaken and abused by people who cross the borders illegally to come take advantage of that and putting a strain on the health system?
The previous time we raised an issue of the backlog of surgeries in the province. Let's go to that list of backlogs that the province is having for patients who are awaiting surgery in the province. Whether it's the majority of them or those people who are there are people who are from other countries. The system itself is failing to maintain, or it's failing to deal with the challenges that it's facing. Challenges of infrastructure. The other challenge is the challenge of shortage of staff, challenge of specialists, which the department is failing to address. And hence the department wants to blame our own sisters or our own brothers who are coming from other parts of African continent.
Yeah. We're
not going to tolerate that, and it's Afrophobic.
Lesiba, let's bring you in here. The MEC saying she was having a conversation with the patient, trying to explain the kind of burden that the budgetary constraints of the province are currently having to contend with. Is that an adequate enough explanation of what happened there, or do you believe she violated the dignity of that patient?
Good evening, Thabo. Look, let's welcome the opportunity to react on what has taken the nation by the storm. Yeah, actually, I think it was a bit inappropriate, even though the discussion in itself would have been appropriate at a particular platform. But the platform where the discussion was taken was a bit appropriate, even though if you listen to the MEC, she will have a good discussion if it was placed in a correct platform, in a political arena where policies will be discussed, not with direct with the patient, because the patient herself, in this Women's Month, by the woman itself, it was not a good scene for us as a union. But we understand that the patient did not deliberately just came here to abuse the system of South Africa. It is because of the environment she found herself in, from from Zimbabwe. So what we're saying is that the topic is a very serious topic that we must engage, because yes, ourselves as nurses, we have got a very serious burden, but not only because the burden is from immigrants only. The shortage, the gross shortage of staff in this province, it's also contributing to the backlog that she's talking about. Even if we can take the foreigners out of our hospitals and our clinic, still the staff, especially the nurses that we are having, the system that is failing to absorb the nurses they train themselves, or to even train new nurses to fill the vacant posts, or even to eradicate this issue of acting without payment. We will still not cope because we are grossly understaffed. So the problem is that topic is a political topic, more administrative, and to us as nurses, we wouldn't appreciate that topic to be directed to the patient herself. Maybe the patient maybe never saw a president live herself, like many of our citizens never met our own Honorable Cyril Ramaphosa. So to direct her to Mnangagwa, it was also to us not that palatable at all.
Yeah. Lesiba, she's pointing, I think she said Chiliti, if not Chukundu, that she says where they took this elective program to, where 19 out of the 27 surgeries that they conducted there were done on foreign nationals as opposed to beneficiaries being the people of Limpopo. In your view, can healthcare be limited depending on the availability of resources when it comes to non-nationals?
Look, Tab, I will still repeat, even if we take all foreign nationals outside the country, our hospitals in Limpopo are dilapidated. Our clinics in Limpopo, around 400 of them, less than 30 of them are able to, less than 30 can only provide 24-hour service. Out of 400, more than 400 clinics, we're talking about only 30 at the primary health care level that can at least provide 24-hour service. That in itself tells you that the system, irrespective of the foreign national, the system is not in order. It's not in order because that's why we are always in the media saying one patient has delivered outside the gate, but the truth is not being told that the very same clinic where a woman has delivered outside the clinic, that clinic, chances are it does not meet requirements to operate 24 hours, and it's only our nurses who will be brought to book, who will be seen in media being harassed, and we want it to come to an end because the system in itself, it's not working. Our hospitals are dilapidated. You go to any hospital in the rural area, you'll find that the laundry is not working, or even the mortuary is being run by nurses because we've got shortage of staff. So we cannot only talk about local, international immigrants. We need to sort our system first before we can now say no. They are also consuming the little that we are having.
Lilian, Section 27 of the Constitution of South Africa says access to basic health care services should not be denied anyone, including non-nationals. No one may be denied emergency medical treatment. However, it goes on to say that those who do receive emergency medical treatment beyond the basic health care services may be liable to pay. In your view, do you think that is a part of the Constitution that hospitals in South Africa should begin to adhere to where they have not done so in the past?
Thank you, Mr. Mdluli. The way the issue was addressed by the MEC there at Villa Villa, we still say it's not appropriate. Even if you are owing whoever, no one should go out or in front of other people and humiliate you and embarrass you in front of other people, telling you about the debts that you will be owing. The patient has the right to be treated in totality. So the patient had physical problems. But the MEC is now contributing to other issues that the patient should suffer, like embarrassment. So psychologically, that patient should be affected. We're saying no matter what the limitation of budget is, no one, not even illegal immigrant, deserves such a humiliation, such a treatment that we have seen that sister of ours from Zimbabwe was given by the MEC.
Lilian Managa, appreciate your time, and Lesiba Monyaki, and thank you very much for coming on and joining us tonight here on In Focus. Look at your reaction, 072-110-5584, to what is the conversation tonight. Nico saying Dr. Ramathuba goes nowhere. She was speaking on behalf of all South African taxpayers. Our family members are strained at healthcare institutions because of the influx of illegal foreign nationals. Why are we so accustomed to lies and corruption that when someone speaks the truth, we deem them problematic? Anonymous saying reality has just struck our politicians as we have been crying about such issues. MEC, you are 100% correct. Dr. Phophi Ramathuba was being honest, and for that we must appreciate her. Yes, it might not solve the issues that are already there in the health system, but it's definitely something that we must start speaking about, how foreign nationals need to start paying for the facilities. Some of your thoughts tonight here on In Focus, much appreciated.